Josh, one of the big issues with Medicare is it's just a dramatic increase in Medicare Advantage, which is, you got Part A and Part B and Part D, and this is sometimes referred to as Part C. But these are private insurance plans that contract with Medicare to provide the Medicare bundle of goods and services. And it started out kind of as a experiment or a pilot years ago. I can remember it being kind of a side issue with Medicare when it first started out, and now it's quite a big deal. What are the trend lines in Medicare Advantage, and then we can talk a little bit about why it's growing.
Yeah, I mean, the big deal is that over the last decade, um, enrollment in Medicare Advantage has gone from about 15% of Medicare beneficiaries to over half of all Medicare beneficiaries. And the National Health Expenditures report just showed that 52% of all Medicare money was spent in Medicare Advantage as opposed to the traditional fee-for-service Medicare program. So that's a these are pretty big milestones. Half of beneficiaries are in these private insurance plans, and we're spending half of our dollar in these private insurance plans. And the big challenge is that this experiment was supposed to test whether private health insurance companies could manage the Medicare benefit more efficiently and at lower cost than a traditional fee-for-service system where we just pay per doctor's visit or for everything a doctor does. And the idea was that was not the best way to pay for Medicare services or medical services. And instead, you would set up a specific amount, pay an insurance company that amount to cover someone for the year. And if that person had less healthcare spending over the course of the year, the insurance company could keep some of the money and then give back some of the money to the beneficiaries in the form of better benefits. And also the government would save some money because they would keep some of the money that you save by treating that beneficiary for less cost than expected at the beginning of the year. So I think we found out through the experiment that private insurance companies can manage benefits to spend less over the course of the year than the traditional fee-for-service system. What we also found out, though, is that the way the program was designed, the government has not seen those savings. The insurance companies are able to keep those savings to themselves, or, well, I should say, or give extra benefits to beneficiaries with that savings. And what that's done is it's supercharged enrollment in Medicare Advantage because those extra benefits are very attractive to shoppers when they're deciding whether to go into MA or whether they're going to stay or enter into traditional fee-for-service Medicare. So we basically created a program that is much more generous, at least on the surface, than traditional Medicare. Congress never voted to add more generous benefits to Medicare. They certainly didn't raise taxes to pay for these more generous benefits to Medicare. So that's why Medicare Advantage has become a federal budget problem, because we do have half of beneficiaries in this now more expensive system, more expensive than had everyone just stayed in Medicare fee-for-service. The Congressional Budget Office just looked at what would happen if we kind of changed Medicare Advantage to not have all these extra profits sloshing around. And they found the same thing that I found when I worked at the Committee for Responsible Federal Budget, that we have about $1 trillion to $1.5 trillion over the next 10 years projected to go to these extra benefits and extra profits for Medicare Advantage insurers relative to if everyone just stayed in traditional fee-for-service Medicare. So that is a lot of money over the next 10 years. We call these overpayments to Medicare Advantage plans. But those overpayments, again, are going partially to give more generous benefits to beneficiaries, and thus is the political challenge to do something about it in the future. And all of this is taking place against this backdrop that we've talked about of lower aggregate healthcare cost growth. So we might have actually had a real slowdown in healthcare cost growth had we not been sending all of these overpayments to Medicare Advantage plans.